Hi. Welcome to Operating Room 8. My name is Antiques and I will be the circulating nurse.
Great. My name is Rudy Wakening. I am a Cincinnati State student and I will be circulating with you today.
Nice to meet you. What is it that you are working on today?
I need help with filling out the intraoperative nursing record. For those of you following along in the audience, you can refer to the paper packet that was handed out at the beginning of the presentation.
The first thing we need to do is to make sure that we have the right patient information for this case on the reference sheet. The patient is Mr. Bendover, and he is having a cholecystectomy, which is to remove the gallbladder and to drain the obstructed common bile duct.
Okay, so where do we get started?
When we meet Mr. Bendover in the hall, the first thing we want to check is the green sheet on the front of his chart to see if there was any information that admitting wants us to be aware of. This sheet is used as a quick reference to communicate important patient information between pre-op, intra-op, and PACU. What do you think we have to do after that?
We need to check the patient's chart with his ID wristband, ask him his name, date of birth, name of his surgeon, what procedure he is having done today, to point to the location of the surgery, and ask him when was the last time he had anything to eat or drink. We need to look through his chart to check his lab work, and to make sure that the consent form is signed and witnessed. We will need to transfer the patient to the operating room bed.
So let's get the patient transferred over so that the anesthesiologist can put the patient under. What position do you think we will put the patient in?
In supine and maybe reverse Trendelenburg to help with the visualization of the gallbladder.
Patient is positioned, padded, and covered with warm blankets. The surgery starts now. We can start filling out the intraoperative record. Normally, this is documented in the computer system using a program called Epic, but for training purposes we will use the paper version today.
Okay, I start by putting the date March 21st, 2012 and the time, 7:45 a.m. We are in operating room number 8. The method of transfer was a stretcher.
Now, go through the patient's identification section and check all the boxes that apply to this case.
Okay, he gave us verbal identification. We looked at his chart. We checked his armband and asked if he had anything to eat or drink past midnight, and he told us that it was 10 o'clock last night when he last had something, so we will chart all of that.
When we looked at the chart, did you see any allergies reported?
Yes, ellipsis. Right here it says that he is allergic to sulfa drugs.
So write that in. For verification of the procedure and location, go ahead and check the consent box and the patient verbally states box. Write in gallbladder removal.
Under consent to treat, we will check patient signature. For H&P, check on chart. For lab data, check on chart. X-ray is not applicable. Blood was type screen. And finally EKG check not applicable.
Now what about his mental and or emotional status?
I would say he was alert because he answered our questions, and oriented because he knew where he was.
Right. Were there any limitations for this patient?
He had no limitations, so I would check none.
Did he bring any of his belongings in, like maybe dentures, glasses, or contacts, or jewelry?
No, so I would check not applicable for all of those items.
So, were there any actions taken?
No, so not applicable on action taken.
On the received by line you would put me, Antiques. The pre-operative nursing assessment was completed by Sharon Needles.
Great, first page is almost complete.
Now, we are to the nursing diagnosis, where it says potential for anxiety related to knowledge deficit. For plan of implementation, what do you think is the best choice?
Maintain quiet, private atmosphere.
Yes, and for nursing notes or comments, I don't have any at this time, but we can go ahead and check the box above. Evaluation, what do you think is the best choice?
Let's see. He didn't talk much, but he looked calm, so I would say relaxed facial expression.
I think so too. Good job. I love working with Cincinnati State students. The operative record section type of anesthesia would be AAC, so check that. Wound class, that would be 3 contaminated.
All right.
Go. Down to times.
Patient. Ing was 7:45 a.m. Anesthesia start was 8 a.m. The procedure start was 8:15 a.m. Procedure ended at 9:05 a.m. and the patient was out at 9:20 a.m. and heading to PACU.
The timeout was taken at 8:10 a.m. Can you tell me the importance of the timeout?
It protects the patient and the hospital from performing the wrong procedure on the wrong patient or the wrong site.
Yes, it makes sure that the whole surgical team has the same information and that they are on the same page.
Now we have to document everyone that was in the operating room. The surgeon is Dr. Feelgood. Anesthesiologist is Dr. Drowsy. Circulator is you, Antiques. The scrub is I'm a pass-in. And in other, my name Rudy Wakening, and that I am a student at Cincinnati State.
In the black box for procedure put cholecystectomy. Findings were 3 gallstones, one of which was obstructing the common bile duct. The gallbladder was removed and obstruction cleared.
Now, we can move on to the next page.
There's a lot of documentation that has to be done before surgery, during surgery, and after surgery.
At Cincinnati State, they are very particular, so some of the information I have already learned. However, I am always eager and willing to learn more.
Good, then you should be able to help me with lots of different tasks. And I will show you a few other things you will need to know. One of the things we need to document is what position the patient is in.
He is in the supine position, and we made sure his head, knees and heels were padded for protection.
We also extended his arms on padded arm boards, and when he was positioned we made sure that his knees were over the knee break to prevent any injury. And we documented that the safety belt was applied 2 inches above the knees.
Can I set up the ESU and apply the grounding pad?
Sure, that's something that needs documented too. We need to know the ID number, the setting. The ESU is on condition of the skin before and after the grounding pad was applied.
The ID number is 6234A and the monopolar and bipolar are set for 35. Don't we need to document to place the grounding pad as well?
You are correct. Those instructors have taught you well.
Well, want to kind of beat that stuff in our heads, over and over and over again.
Let's see if the ST is ready to do the counts. We both have to verbally and visually watch the count. Why do you think that is?
It is the hospital policies to have 2 people perform the counts. One of the people has to be an RN, right?
You are correct. We will start with needles. We have 1, 2, 3, 4, 5 needles. Then we'll do the rate tech 4x4. Sponges. We have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 in this first pack, and 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 in the second pack for a total of 20 rate tech 4x4 sponges. Thanks, I got it. See, Rudy, we have to document counts before and after each case, and notify the surgeon if there are any problems.
So, when the surgeon drops a needle on the floor, but we find it, then this should be documented.
Yes, and what if we didn't find the needle? We would need to call in a supervisor and possibly do an X-ray to see if it was left in the patient. As you can see, everything is documented.
So circulators are not just sitting in the operating room surfing the internet. There are lots of things to do.